Hi everyone, welcome back to my channel Dr. Shahan's class, and here in this video I will teach you about Boerhaave syndrome. Now why I am teaching Boerhaave syndrome? Boerhaave syndrome is very important for NEET PG FMG examination. For medical examination point of view, Boerhaave syndrome is very important. This is spontaneous esophageal rupture. Always remember what is Boerhaave. It is esophageal rupture, esophageal tear. Where does this tear generally occurs? Lower one third of esophagus. Lower one third of esophagus. Now it is related with alcoholic. A person who is binge drinker will get this syndrome, Boerhaave syndrome. Now there is a triad known as Mackler's triad. Mackler's triad is related with Boerhaave syndrome. It has three important components. One, the patient will come to you with vomiting, and the patient will have subcutaneous emphysema and chest pain. So three important feature, always remember: vomiting, subcutaneous emphysema and chest pain. So these three will be there. There was a MCQ where they want to mark you that which is not a part of Mackler's triad. They have given vomiting, they have given chest pain, and they have given subcutaneous emphysema, but they have added fever. So fever will be the answer. Fever is not a part of Mackler's triad. Fever is not a part of Mackler's triad. So remember this thing. Now how will you investigate? We investigate with the help of chest CT, and chest CT with contrast. Always remember, we use chest CT with contrast. With contrast we use, and that is the investigation of choice. So investigation of choice is chest CT with contrast. Chest CT with contrast. But generally when the patient comes with vomiting, when the patient comes with chest pain, when the patient comes with Boerhaave syndrome, subcutaneous emphysema, we generally ask the patient to do a chest x-ray first. But that is not the investigation of choice. Always remember, they always ask you in the examination, what is the investigation of choice? IOC, investigation of choice is chest CT with contrast. Chest CT with contrast. You have to use contrast material and you have to do the CT for diagnosis of this Boerhaave syndrome. And always remember, it is related with retching chest pain and syncope, and the patient has a history of alcohol. Now look at this picture. This is showing you the x-ray, and you can see the right sided black colored small arrows. They are showing you mediastinal air. They are showing you mediastinal air. Another thing which I will mention is Hamann sign. Another thing which I will mention is Hamann sign. Now what is this Hamann sign? This is a mediastinal crunching sound. Very important. Remember this. It is a crunching sound present in mediastinum. So mediastinum crunching sound, it can be heard over the chest, and sometimes it synchronizes with the heartbeat. So remember this thing, Hamann sign. They will say about Hamann sign in the question. So whenever there will be a question of Boerhaave syndrome, they will tell you a crunching sound heard over the chest. Crunching sound. Whenever they will say this word, crunching sound said heard over the chest, it is Hamann sign, Boerhaave syndrome. Now look at this picture. This picture is showing you left side is achalasia and the right side is Boerhaave syndrome. We can differentiate these two phenomena, achalasia and Boerhaave syndrome, based on some features. Left side is achalasia. What is achalasia? I told you, it is failing to relax of the less, that is LES, lower esophageal sphincter. So achalasia means lower esophageal sphincter is failing to relax. It cannot relax now. That is achalasia. So there will be history of weight loss, trouble swallowing anything, and history of travel. This is achalasia. But on the right side you can see the picture. It is showing you extravasation of contrast. Very important. Extravasation of contrast. They will surely give you a patient who is alcoholic and the patient was doing forceful retching. So forceful retching, crunching sound, Haman sign. Remember this. All these are differentiation. Now this is a bonus tip for how can you differentiate achalasia. I told you about this. This is a video of Boerhaave syndrome, but still you should know about achalasia because it is very close related. Achalasia means absence of relaxation of which sphincter. Always know, remember, it is lower esophageal sphincter. LES, lower esophageal sphincter. Failure of relaxation of lower esophageal sphincter. Failure of relaxation of LES due to loss of myenteric plexus, also known as Orbach plexus. Due to loss of myenteric plexus, there is a plexus known as myenteric plexus, Orbach plexus, myenteric or Orbach plexus. This plexus is lost. So they may give you a question on which plexus loss you can get achalasia. The answer is option. There will be myenteric or Orbach plexus. Remember this.